Wow. So that's a great way to start the panel. Our next speaker, Ogonnaya Dotson-Newman, is the Director of the Environmental Health for WE ACT, which is in New York. It's the Environmental Justice Program. And we have deliberately, this panel is deliberately different sectors, but I think as you listen to each one of them, if you work in population health, you're going to say, well, wait a minute, that's health. So let's hear now how we might draw that same conclusion from environmental justice.
So I think that's a tough act to follow, but I'm going to try. A lot of my presentation is not just about kind of like the work that WE ACT does as one of many environmental justice organizations across the nation and across the world, but it also frames up how WE ACT thinks about environmental justice and what the environmental justice movement looks like. And I think that this is important in kind of like thinking about how I fit or how WE ACT fits into this really interesting discussion about population health and some of the tools that we can be able to use to either scale up and think about ways to be able to address health disparities. So I have this slide which really talks about evidence of disproportionate exposures. And one thing that I think is really interesting about this is I noticed that some people on the panel before me really talked about now that we've gotten to a certain place and sort of scaling up all these models, what are the ways that we're going to be able to take some of the issues that we've noticed have happened in the past and be able to address them, because some of the problems that we're dealing with, as we see with homeless, are still the same. And although we've been fighting really hard to be able to end racism and classism and a lot of these other things, if we don't begin to think about how these disparities and how the things within our social society kind of contribute to these ongoing disparities, we end up with what you see is an initial report that happened in 1987 that really talked about and was really the first piece of evidence to talk about geographic proximity of toxic waste sites and how they relate to communities of color and low income. And so a lot of the same folks that worked on this first study that found, right, that no matter what your kind of, I guess, places in terms of your class in society, if you were a black or a brown person living in America, you were more than likely going to be living close to a toxic waste dump. So that means that me, as a person who has a family that came from Toxic Alley or Cancer Alley in Louisiana and whose grandparents then moved to Louisiana, which is another toxic place, has a toxic legacy. And no matter what I do to achieve maybe higher income or better outcomes that should directly relate to my health, I still probably have some things that are going to be inherited because of exposures in my past that I'm going to pass on to my kids that are then going to really be able to contribute to a long history and a long line of disparities and what I call sometimes a toxic legacy. And so what we found is in the update report that happened 20 years later that a lot of these persistent disparities exist. And so what I really began to ask is, does that mean that environmental justice organizations nationwide are failing? Or is there something else that we need to be doing to be able to scale some of the work that a lot of these environmental justice organizations are doing up so that their impact can be that much greater? Because what we'll begin to see on the next slide is that there are many organizations that are like WE ACT, although they don't have the depth and breadth and maybe as large of a budget as WE ACT, but their ability to be able to fight a lot of these toxic things that are in their communities often becomes very difficult because they're working on a case-by-case basis. They're working with one facility versus another facility. They're trying to figure out ways to get around environmental protection laws to be able to create and interrupt a lot of the factors that are driving these disparities that we're talking about today. The other thing that I think is really interesting as I was talking with Dan is that as we begin to think about social movements and how they need to interact with different sectors throughout the world and throughout our economy, is that you're looking at how the grassroots is talking about and thinking about and coming up with solutions to these problems and figuring out how those can meet with the grass tops. What I like to say is that this needs to be some type of continuum. There has to be a way for us to kind of like, I guess I'm also saying this in the wake of what's been going on with Eric Garner, we have to find a way to kind of interrupt and disrupt kind of what the current status quo is, and for then to be able to take a lot of the ideas that maybe seem maybe far-fetched and be able to bring them to a scale where we actually can begin to see measurable results. We have to begin to invest in not just the research, but also research into the solutions that a lot of community-based organizations are scrapping together materials and resources to begin to have an impact on a day-to-day basis. And so I always like this slide because I think it really models and shows a lot of the work that not just WEAC does, but other environmental justice organizations, because it's about reframing and thinking about how are we viewing our environment, how are we viewing our communities, how are we viewing our solutions. The environment is where we live, where we work, where we play, where we pray, not just where we go to like sit on a lake. We're bringing together and really thinking about how we can cross-mobilize a lot of times because many of the organizations are resource, I don't want to say resource poor, but I will because I'm right here, don't necessarily have the resources. So thinking about how we can work with legal aid programs, how WEACT even works with academic universities to be able to expand the way that we get out scientific information to communities of color and low income to then think about innovative solutions to some of the problems that we see. And it's also about including a wide plethora of voices within that. I was kind of like talking about politics and how a lot of times we think about how a dictatorship can be efficient and easy, right? It's also like sometimes how we think about toxicology. If we just look at one chemical, it's very sometimes easy to really focus on that and think about the dose response. But when you start to bring in all of the other things that may be impacting us, it gets messy, it gets difficult, but it also gives us a better picture of what we're also dealing with so that we can also think about realistic solutions. And then that really leads into what I was talking about in terms of thinking about cumulative and multiple exposures, thinking about the way in which we think about policies and practices that will then lead into, I guess, WEACT's mission statement, which is my next slide. So WEACT is known as the Community Health Watchdog here in Northern Manhattan. For those of you that aren't from New York City or aren't familiar, that is basically where we are now is considered East Harlem. Everything above kind of like 110th Street going up to 220th Street here on the island of Manhattan is considered Northern Manhattan. There are a number of different communities in this that have different community populations. So right now we're in East Harlem, which is traditionally known as El Barrio. For a long time it was an Italian community. Then after that it became a Puerto Rican neighborhood, and now it's also has a large population of folks from Central, South America, and Mexico. And when you talk to people that are doing work in these areas, you find that people are kind of like meeting the needs of that diversity. You have Central Harlem, which is known for being the place where the Harlem Renaissance took place. You have lots of immigrants from West Africa. You have a quickly kind of like changing population due to gentrification. And then you have West Harlem, which also has historically African-American community. Also, you have folks from the Dominican Republic as they kind of come down from what we call Washington Heights, and then into Inwood, which also has some similar changes. The reason why I bring that up is because those are four very rich communities, but also you're looking at like 550,000 people in a square area of 7.4 square miles. And this is the place, these are kind of like the areas where you can really look at and understand how all of these different intersectional pieces need to come together, because you have people that live 10 blocks apart that have very, very, very different health disparities. And we know that it's not just their air quality outside that's impacting those. We know that there's a number of different sectors and folks that are going to have to work together to be able to figure out really creative, healthy solutions to that. And I just wanted to finally say also that the thing that I really like about our mission, and I think that this is important when we're talking about scaling up things to address population health, is that we focus on health and protection policies and practices, because we can put together policies to do good research, but if the people that maybe are implementing that research aren't thinking about the biases that they're bringing into that, or if we're putting together nice policies and the people that are implementing those policies aren't thinking about the practices that they're, or the biases that they're kind of like using to create that, you end up with huge disparities that then are driven to a bad policy, bad practices, and then leaves us kind of like right back where we started off. I also put this model up here. This is the model that WEAC does its work. You have training and empowerment. So that means that we're working with people on the ground in East Harlem, in West Harlem, in Washington Heights, Inwood, to really be able to understand what are some of the things that they see. I know that we're here in this academic institution, and we want to say that there is more research that's needed, but oftentimes people know what's going on with themselves. They just don't use maybe the same language that we use to be able to describe it. They know that something stinky is coming out of the sewage treatment plant, and at 4 o'clock they get a headache. They're not going to say, oh, we think it was methane at 4.5 parts per whatever. So it's taking that language and then figuring out how we can be able to use the things that they're all observing and knowing to translate either into advocacy or to research. So we do advocacy at the city, state, national level, and sometimes that means taking folks that we community organize with to talk to some of their city council officials or to talk to their elected officials or their senators. And then also that means that we're working through community academic partnerships. We have a partnership with the Columbia Center for Children's Environmental Health, where we take some of their information that they're developing around molecular epidemiology, and we put it into plain language so that people can then either take that and then make better policy, or so that we can train folks to be able to understand how they can be able to either A, advocate better for themselves, or take personal steps to be able to limit their exposure. The example that I was going to give around scale and spread is really related to an idea and a policy. And the, I guess, endpoint that I like to see is a lot of people saw the climate march, which had over 400,000 people come here to New York City to talk about the need to really make a change related to climate change. I like to think that this really started over like 20 years ago in 1982 around a civil rights and environmentalism issue that happened at a PCB landfill in South Carolina. And so that was the first time that there was really what we say a historical environmental action. Through the work that was done, there are a lot of individual groups that work locally to be able to think about issues that impact communities of color and low income, like as a national level, and they were able to work together locally and nationally to get an executive order signed in 1994. I think the work that was done to get that executive order signed and to really get environmental justice as a word and as a concept on people's minds to think about how all of these different things impact where we live, work, play, and how that impacts our health has really led to people being trained in community organizing, to people's awareness growing, to government agencies really thinking about this in their rulemaking, to researchers partnering with community-based organizations to better understand what's going on in their communities. And then that then relates to a great amount of people that are then trained and understanding so that they can bring those messages and bring that information into not just the way that they think about organizing to create change, but also the way that they, tactics that they use to be able to make it a broad-based kind of like phrase that's on the tip of everyone's tongue. And I thank you. There's my information. There's a beautiful picture of We Act, and I think I have one more picture of a sign that we use to really be able to talk about and engage people. Thank you.